Hello, a very good evening, ladies and gentlemen, and I welcome you all back to my channel. As you all know, my name is Dr. Tuba, and my main aim through this channel is to guide all the medical professionals, and especially the dentists who would like to consider other countries as an option to work in. So in my previous video, I talked about Germany, talked about the prerequisites, how to apply, and in general, we spoke about the registration process. So in this video, we're going to talk about the main license exams of Germany. Now, just to recap from the previous video, a very quick and brief recap. First, you have to learn, or you have to decide which state you would like to go in. Then you start learning the German language till B2. Then you collect all the documentation as stated according to the website of the recognized body where you would like to go. And then you have to translate all those documents into German language from a certified German translator. And once that's done, you send the documentation. Now, the main aim to send the documentation is because we have to apply for the license exams. Now, the first license exam is the FSB. Basically, there are two exams. One is the FSB exam and the second is the KP exam. Please do not ask me for full pronunciations and of the FSB and the KP, because I think I would not be able to pronounce it properly. So for clarity, I'm going to call it the FSB and the KP exam. So let's talk about the FSB first. The FSB exam is actually the German medical language exam. In this exam, it is actually a 1-hour exam, and the main aim of this exam is just to test how well you speak and understand German when you're talking to a patient in a clinical environment. So this exam is a 1-hour exam, and it has 3 parts, each divided in 20 minutes, 20 minutes, 20 minutes, 20 minutes. So the first 20 minutes, what happens is you have an actor who is a patient, and he would come to you and he will give you a whole history of, in German, he would provide you a history of any medical problem, any dental problem that he has. So you have to prepare his case, ask relevant questions, history taking, we all know the drill, and of course jot down the main points of what exactly is the problem. In the second one, of course, you have to prepare, in the second 20 minutes, you have to prepare, you have 20 minutes, I'm sorry, in the first you have 20 minutes to talk to the patient and write down the history. In the second 20 minutes, you have to prepare a proper case history, prepare the case, diagnosis, treatment planning, etc. You have 20 minutes for that. And then in the third 20 minutes, the last 20 minutes, you would have examiners who would, cross-question you. They would ask you questions. What is the diagnosis? What is the treatment planning? And some questions internally. More or less how it happens in the DTP of the ORE exam. So this is actually the FSP exam. Right after that, they would tell you if you passed or failed the exam. And of course, very, very important, you have to speak very good German. Make sure that you learn and practice German well enough so that you could give this exam. Without proper German language knowledge, you would not be able to pass this exam. So once this is done, after that, you have 2 years to give the KP exam. In the KP exam, basically what happens is it is a little complicated exam. The KP is a 4-hour long exam. And it doesn't really have a theory. It has a practical and it has a viva. So let's talk about the practical first. The practical is all about the clinical practice. You would have teeth, mannequin. It's more or less like how you do mannequin in the ORE Part-2 exam, where you have to prepare cavities, crowns, access cavity, etc. So that is the practical part. Then comes the viva part. In the viva, you would have examiners, and they would in detail ask you everything what they want regarding the dental knowledge that you have, cross-questioning, of course, and they would in detail and depth ask you a lot about the dental knowledge that you have. Now, this here is a little tricky, because you need to make sure you speak very, very good German and you understand very good German, because of course this entire exam is going to be in German. So once you get done with that, you have both the exams done. Now you are certified, you can work. So in Germany. So this is actually the whole procedure. And of course, I wish you all good luck with that. I do realize that Germany is a little different from the other countries, but of course I do recommend, if anybody, especially there due to in spouse visa, for example, if the person has a spouse visa or the person went there for educational purpose, for masters, bachelors, masters actually, or PhD, I really recommend that you should go ahead with this. And of course, if there are any other questions, you're more than welcome to write to me. The details are mentioned right below, and I wish you good luck and have a lovely day, everyone. Thank you.